Get your headphones in so you can hear me. Okay. Hello, welcome to the webinar. My name is Ashley Hartman. I am from Recovery Resources, and I'm joined today with Kitty Leung to talk about gambling in the Asian community. So we're going to go ahead and get the webinar started. I have some housekeepings just to remind you at the beginning of the webinar. So to receive your CEUs, you need to keep the webinar open on your screen so we can see that you are actively participating. You need to make sure that you participate in the polls. So you'll see those launch, so make sure you participate in the polls. And then at the end, you will receive a post-test and evaluation. I will let you know it does take an hour before that link to the post-test and evaluation is sent out. So it will take a moment, and then after you complete the quiz, you'll automatically get your certificate. Also, I wanted to introduce Recovery Resources. We help people triumph over mental illness, alcoholism, drug, and other addictions. Our services range from mental health and addiction prevention and treatment to services to support individuals such as housing and employment. We offer services to employers through our Employee Assistance Program, and finally offer training and education similar to this webinar. To learn about future trainings, visit our Training Institute page at recres.org/education. We offer a variety of clinical and non-clinical trainings. I will now turn it over to our presenter, Kitty.
Hello there, my name is Kitty Leung. So here is today's agenda. I thought it would be helpful not just to look at factors that contribute to problem gambling for Asians, but more broadly at the immigrant experience. So we're going to be looking at also how to work with interpreters, what's the legal definitions for migrants, refugees, asylum seekers, and the like, and then also what are best practices of working with the Asian population. So before we get to that, I'd like to look at poll you. So we'll go to question number 1. So have you ever worked with an individual from the Asian population in gambling prevention or treatment? Go ahead and respond to that.
So we can see how many people participated. So go ahead and close.
Okay, it sounds like most have not, and some have. So this is good for me to know where you're coming from. Let's look at the next slide here. All right, so I work at an organization called Asian Services in Action. We're a private nonprofit organization located in Northeast Ohio. We actually have 2 offices, one in Akron and one in Cleveland, but we serve individuals and families all over Northeast Ohio, and even some of our programs serve people statewide. We are a culturally specific and community-based organization. We have 7 different departments, and that includes also our International Community Health Center, which is a federally qualified health center. The mission of Asian Services in Action is to empower and advocate for Asian Americans and Pacific Islanders, and to provide them and other communities access to quality, culturally and linguistically appropriate information, health, and social services. Again, my name is Kitty, and I was born to an immigrant family from Hong Kong. I've lived most of my life here in Northeast Ohio. I speak English and some Cantonese, so I was raised basically with Cantonese-speaking parents. At home, I spoke Cantonese. At school, I spoke English. And I am currently the Senior Manager of Children, Youth, and Family Services at Asia. I have a social work licensure and received a Master's of Applied Social Sciences degree from Case Western Reserve University in 2006. The department that I oversee includes services such as domestic violence, sexual assault, human trafficking case management and advocacy, English language education for K-12 students, parenting education, kindergarten preparedness, drug prevention services, and education around drug prevention, behavioral health services such as women's educational peer support groups, groups around alcohol abuse. We also do the outreach in problem gambling as well from our department. CYF service department also helps to integrate our health clinic and social service aspect of the organization, since the health clinic actually was not developed at the beginning of our organization's inception, but was developed later. And we also provide outreach and education to ethnic communities, the community at large, as well as service professionals. Clients that we work with might receive services from several of our departments, so we work closely together throughout the agency to problem solve and streamline services. We also have strong partnerships with other agencies, including refugee resettlement agencies, in order to better serve the communities. And though we do provide a lot of different services, we look to other agencies such as Recovery Resources to provide services that they're in a better position to provide, or try to help increase their capacity to reach out to immigrant populations, because we all know there's a lot of work to be done. All right, so though the mission says that we serve Asian Americans and Pacific Islanders, we also serve individuals and families from around the globe in other areas, including many refugee populations that have been resettled in Northeast Ohio. The Asian American Pacific Islander population remains the majority of those we serve, and in the Midwest, it is actually the fastest growing racial group. According to the census, the Midwest Asian population grew 47% between 2000 and 2010. However, the number of impoverished Asian Americans in the Midwest has also increased. Since 2000, the number of Asian Americans living below the poverty line increased in large metropolitan areas throughout the region to as much as 57%. Per capita, Asian American incomes consistently fall below those of white Americans, and the poverty rates of certain ethnic groups are comparable to those of African Americans and Latinos. Also, contrary to stereotypes, Asian Americans in the Midwest are not universally well educated. Data show that they are less likely than white Americans to hold a high school degree. In Ohio, Ohio itself has been home to Asian Americans since the mid-20th century, when Chinese Americans, many of whom were born in the US, left the West Coast in search of greater opportunities. Cleveland's Asian American population has grown significantly since the 1960s, with large numbers of Filipino and Korean immigrants. And after the Vietnam War, Southeast Asian refugees, such as those from Laos, Cambodia, and also Hmong refugees, settled in the area. More recently, we are seeing waves of refugees from Uzbekistan, Burma, and Bhutan. So I'm going to actually conduct another poll, number 2. What has been the most challenging aspect of working with Asian population, or what do you anticipate as the most challenging? So it looks like language and cultural issues are about evenly have an even response there. And maybe after our presentation today, you'll see more things to consider when working with Asian populations that you haven't considered before. So, let's see here. So there are different rates of problem gambling among Asian ethnic groups in the United States. For example, noted in the literature, we see a much higher level of problem gambling with Chinese immigrants and Southeast Asian refugees. Culture may account for these varying rates of problem gambling within different ethnic groups, as well as the preference of gambling activities. Moderate gambling in Asian immigrant groups can be socially acceptable forms of entertainment, and so children who are exposed to these practices are at increased risk for them to develop gambling disorders. Some examples of the games that Chinese children may be exposed to include mahjong, pai gao, card games, lottery, horse racing, and sports betting, but for different ethnic groups, there are different types of gaming. Some immigrants may also view gambling as a valid way to earn money when they're facing financial hardships. And then migrants that had a history of trauma, such as the refugee population, could look at gambling as a way to cope with that trauma and also the difficulties related to experience of moving to a new country. Many immigrants also seek the companionship of other immigrants, so gambling can be seen as a means for connecting with others and socialization when their current situation in the United States might keep them very isolated. Addiction and mental health treatment services in the United States are not utilized by most Asian and Pacific Islanders that need them, and they're less likely to seek treatment than other minority communities. There is a lack of understanding of addiction and mental health, as well as lack of knowledge of availability of services that can provide the right treatment. Consequences of addiction or mental health issues also tend to be reported as somatic symptoms. So there could be a lack of recognition of the base issue. Cultural and language differences between providers and clients present significant barriers to clients being able to access services that work for this population as well. And when accessing services, in general, first-generation clients are also more likely to prioritize immediate and tangible basic needs over other needs. There could be a stigma associated with having a mental health or addiction disorder, and there's a concept in East Asian population called saving face, which is basically the need to keep up one's reputation among other community members. As mental and behavioral issues can be seen as a sign of weakness, a lack of willpower, or even can be related to a spiritual condition. Help-seeking behaviors are also influenced by culture, and that impacts who people feel as capable or appropriate to assist. So there may be a preference to discuss issues with people who are closer to them, like family members, or people that have a particular role in the community, like clan leaders, or people might generally want to deal with a problem independently. Okay. As a multi-service agency, Asia has been able to provide wraparound services for our clients, and because of this, it can be easier to integrate problem gambling, education, and outreach into these types of services that clients are actually coming to Asia for. Also, partnerships with other culturally specific organizations, such as like ethnic specific churches or community like clubs. They help us to access and develop relationships with community members by leveraging their relationship that they already have with the community. It is helpful to also be aware of a community's cultural values so that you might align your services or practices with those values and thus be in a better position to speak to that community's needs. Also, it is good to find a way to connect with the priorities of immigrant population. More often than not, again, they are focused on surviving and ensuring basic needs for themselves and their families. So they will be prioritizing earning money, learning English, obtaining status as a citizen over other needs. In many cases, it could be easier to connect with the second generation immigrants. Those are generally people who are born in the United States, or maybe they came here as at a very young age, and they are more than likely more accepting of or familiar with the methods of providing service that have been developed for the American mainstream population. You also want to make sure that your organization has a language access plan and that you know how to tap into that into the language resources that are available either in your organization or in the community, should you have the need for like translation or interpreting services. So we got to poll number 3 here. Do you know the similarities and differences between an interpreter and a bilingual advocate? Okay, so it's good news to see that more people do know about the differences, but we are going to review the definitions of interpreter, translator, bilingual advocate, and bilingual professional. So an interpreter is basically an individual who is whose role is to convey ideas orally in another language. A translator is basically somebody who translates material through written language. There are 2 types of interpretation we call consecutive and simultaneous. Consecutive interpretation occurs when a speaker says a sentence or 2 sentences in a source language, and then the interpreter conveys the meaning of the sentence in the target language. Simultaneous interpretation occurs when the interpreter interprets sentences in the target language while simultaneously listening and comprehending the next sentence. And this is usually done by highly skilled interpreters, and probably we normally see this with American Sign Language. Be aware when thinking about translating materials that are that not all first generation Asian Americans or Pacific Islanders are able to read in their native language, and make sure that you know the organization who's doing the translation, their procedures for translation, so that you know how to present your materials to them for translating. For example, I'll give you a funny example. The battered woman shelter had their materials translated, and when they received the materials back, they literally translated it as a woman who was dipped in batter and fried, because they will do like a literal translation. So you might need to figure out the procedures, and then you will know best how to present the materials to the translator. The interpreter's job is to provide interpretation assistance and aim for clear communication between the client and the service provider. Whereas the bilingual advocate's primary role is advocacy for clients who are non-native speakers, so they are more involved in helping the client access needed services and work primarily with the client. So, for example, our bilingual advocates do not act as interpreters. We require that if we're taking a client, for example, to court, that the court we ask that the court provide an interpreter separate from our bilingual advocate. A bilingual professional is a person who works to complete the goal of that professional services with clients that speak a language other than English. So you can have like a doctor who speaks Mandarin as well as English, working with some Chinese client here. When you are choosing an interpreter, you might need to consider whether that interpreter is qualified or certified, depending on your agency's requirement for interpreting. Qualified interpreters demonstrate high level of proficiency in 2 or more languages, has training and experience in interpreting, and also adhere to the interpreter's code of ethics. Certified interpreters are these, as well as certified as competent by a professional organization or government entity through testing, and these standards may vary depending on the certifying organization. There are different levels of professionalization of interpretive services when you look at the different fields where interpreters are present. You will find that courts require certified interpreters, whereas an organization such as Job and Family Services may only require a qualified interpreter. Organizations such as Asia are working towards training interpreters to provide better services for different types of interpreting work, including working with victims of domestic violence, sexual assault, and also working with individuals who are applying for health insurance. While choosing an interpreter, we have found that it's best to seek out those individuals who come from outside the geographic area of the client for the safety of the interpreter and for the client's comfort and feeling of security. Our communities are so small and people can be well connected in an ethnic or language community, so it's important to try to find someone who has little or no connection with the client. Asians sometimes experience a history of ethnic, religious, or gender-based discrimination, so it's also important to choose an interpreter that the individual feels comfortable with, and you can probably even ask your client beforehand if they feel comfortable with a particular interpreter. When in a situation such as a court hearing where you have 2 opposing parties speak the same language, you want to reduce conflicts of interest by providing separate interpreters for each of the parties. Okay. Here we're going to talk a little bit about the legal definitions and some of the implications of immigration. It may or may not, all of it may or may not apply to you, but it will be good for you to know because it can be very complicated. So the legal definition of an immigrant is any alien in the US except one who is legally admitted under special non-immigrant categories. And these immigrants include legal permanent residents or individuals that have green card and also naturalized citizens. We usually use this term as I've gone through the presentation, I usually use the term to just refer to the migrant population in general. As the definition of migrant is actually broader. It's a person who leaves his or her country of origin to seek residence in another country. This term implies that the individual that's leaving has a choice, so generally a migrant is an immigrant who is not a refugee or an asylum seeker. Legal permanent residents are not entitled to any federal means-tested benefits such as Medicaid, food stamps, cash assistance until they have lived in the US for 5 years with a green card or have become US citizens. They are eligible, however, for pay and benefits such as unemployment and Social Security. Legal permanent residents can become US citizens after 5 years as a legal permanent resident or 3 years if they are married to a US citizen. There are a lot of nuances to eligibility for assistance, and in general, things really depend on a case-by-case basis. A refugee is a status granted to a person by the United Nations. It refers to a person who is outside his or her country or nationality, who is unable or unwilling to return to that place because of persecution or a well-founded fear of persecution based on race, ethnicity, religion, political opinion, and or membership in a particular social group. The burden of proof is the responsibility of the individual applying for refugee status. Refugees in the US are eligible for legal permanent residence status and receive a green card after 1 year of continuous residency in the US. And the residency is actually counted from the date of entry. They're usually eligible for public benefits once they arrive with their I-94 legal document, and also have income eligibility, past income eligibility guidelines. When they first come in here, the Refugee Resettlement Agency provides 3 months of assistance where they are able to help them with rental payments and other services. And then after that, they are able to receive 8 months of refugee cash assistance. And then after the 8 months, people who are employed or attending job training may be eligible for OWF or TANF funds as long as they have children under 18, as well as food stamps. So it gets really complicated. So if you have specific questions, I can probably ask, maybe you can let us know and I can get you the answer. An asylum seeker has almost identical qualifications as the refugee, except they enter the US first and then apply to the government for asylum status. While refugees apply outside of the US with the help from the United Nations, asylum seekers are not, unlike refugees, asylum seekers are not eligible to receive public benefits while waiting for a decision on their case. Temporary visitors seek temporary entry to the US for specific purposes, and this can include individuals such as foreign officials, business visitors, travelers, students, and temporary workers. The visas they hold are intended only to be entry documentation and not verification for legal status. Access to services are dependent on the type of visas, and these individuals are more vulnerable. And we do work with people who are on dependent visas, and they're extremely vulnerable individuals. Undocumented individuals do not have legal status in the US. This includes those who entered without documentation and those who overstayed their visa restrictions. Benefits to this group are limited and generally only for emergency services. So emergency food from food bank, shelter, and emergency Medicaid. When working with undocumented individuals, it is best practice to disclose what your internal policies are for reporting to the Immigration and Customs Enforcement Agency or ICE. And also do not ask for documents that you don't need. And always explain why you need certain documents and who will have access to them. Okay. While working with immigrant population, we tend to talk about cultural competence. However, in providing appropriate services, we actually want to lean towards the concept of cultural humility rather than cultural competence. And the definition of cultural competence, as stated by NASW, is a set of congruent behaviors, attitudes, and policies that come together in a system or agency or among professionals and enable the system, agency, or professionals to work effectively in cross-cultural situations. Cultural humility is a construct for understanding and developing a process-oriented approach to competency. It's conceptualized as the ability to maintain an interpersonal stance that is other-oriented or open to the other person in relation to aspects of cultural identity that are most important to that person. Cultural competence can deceive us into thinking that we have knowledge that we can apply to all individuals in a subgroup. And it makes us think erroneously that there's a set of beliefs, attitudes, and values that we can apply indiscriminately across the board. Cultural humility, on the other hand, is about a service provider's commitment to evaluating oneself and seeing oneself as never done with their learning. It's also about seeing the value that the other person brings to the table. So not just the service provider, but what the client brings to the table, and collaborating with that person in order to achieve the best possible outcomes. In order to develop cultural humility, we must not only do so individually, but also strive to advocate for this at the systems level. In building cultural understanding and awareness, we do need to consider dimensions of diversity, such as clients' cultural values, definitions of community, gender roles and expectations, makeup of family, religious beliefs, and the like. And we could do this through the lens of cultural humility in a process that we call cultural interviewing. And cultural interviewing helps us understand the preferences and expectations of an individual that will inform our service delivery. So we can ask questions like, what term do you prefer when referring to yourself, or what group do you identify with? Can you tell me a little bit more about your culture or religion or this custom? Who makes up your family, or who do you live with? Who's the primary caregiver in your household? Who's in charge of making rules or making money? Who do you normally go for help when something comes up? What are your experiences with healthcare providers or law enforcement in your native country? Have you noticed any differences between the type of care you received here and in the country that you came from? How important is it to be on time? So these are just a few questions that you can ask while doing a cultural interview and working with people who are from other areas. And just remember that no one can really know it all about a culture, so it's helpful to be open to alternative ways of thinking and behaving. How you ask a question is actually more important than what you ask. Clients will know whether you are asking to be able to understand and sympathize, or if you're making assumptions about their situation. Don't expect all individuals also to speak for their identity group, and meet people where they're at. Be aware of the unique barriers that these special populations face, and find ways to adapt to their needs rather than expecting them to immediately assimilate to your agency's way of doing things. And with that, I'll turn it over to Ashley.
Hello. So just some further pieces about why Asian Americans, Pacific Islanders are an at-risk group for problem and disordered gambling. So a lot of venues, such as casinos, really cater to the Asian Pacific Islander community. So they do a lot in regards to reduction of language and cultural barriers. One example is with MGM, the casino in Las Vegas. They used to have a large lion that you'd walk through to enter the casino. And what they found is for certain cultural groups, there was a lot of, what's the word I'm looking for? Superstitions around luck and lions. So that was something that they had to change to be a more welcoming place for those in those communities. Also, there's documented evidence that in Asian cultures, there's often a belief that gambling may lead to wealth, not just, in that community, we say those kind of beliefs can be gambling fallacies, fixed false beliefs around how gambling works. So that can be also a risk factor. Again, as Kitty mentioned, a lot of cultures embrace gambling and can be a big part of socializing and family life. Again, there's that kind of on a similar note, there can be traditions and history in many communities. So again, it's really part of the culture and it's really ingrained in that way. And the last, social isolation. Casinos are very welcoming places. They're created to be welcoming. I think of this similar with older adults, those facing social isolation, looking for a place to socialize and be with other people. Casinos can really be that type of place for different communities, including Asian Pacific Islanders. So some statistics on this. A study from Connecticut looked at 96 immigrants, and about half were found with the probable pathological gambling, which is very high in comparison to the general community. Another study in San Francisco found that 21% of the Chinese community could be identified as problem gamblers. So those rates are much higher than the general public. I want to talk now more about the partnership between Recovery Resources and Asia. In my earlier introduction to Recovery Resources, I didn't mention this too in depth, but Recovery Resources is the agency here in Cuyahoga County doing a lot of work around problem and disordered gambling in the areas of prevention and treatment. So we did in 2014 a community readiness assessment to gauge where our community is at in regards to knowledge of the issue, readiness to take action on the issue, essentially gauging, where we need to work on to further progress problem gambling treatment and prevention in Cuyahoga County. So through that community readiness assessment, we identified, as kind of the previous information is what Kitty covered, emphasize is a need to work with the Asian Pacific Islander community. So as Kitty mentioned, working with culturally specific agencies is a really effective way to reach that population. So we reached out to Asia Inc. to work on a program together. So the first year we worked on developing some culturally specific materials and working to get those into community events. And then we started partnership on our Catalyst Bystander Intervention Program, which we have implemented with other populations, college students, older adults, high school students. And what the Catalyst Bystander training is all about is we train people when they're out in the community and they observe something of concern related to mental health, addiction, and sexual violence, what they can do to respond. And we have 3 strategies that we give them that they can use to respond to those situations. And the Catalyst Bystander program was a collaboration between Recovery Resources and the Cleveland Rape Crisis Center, as the bystander intervention model is a very popular strategy to use in regards to sexual violence. So we worked on that program together and we developed it so it was appropriate for the Asian Pacific Islander community. We also have offered various trainings on gambling to staff at Recovery Resources. We've worked with folks in the Cleveland office, and this year we'll be working with folks in the Akron office, as Kitty mentioned, their sites. This is our, one of our partnerships is actively happening right now by implementing this webinar and making it available live, and it'll also be available on our website for home study. So if you have colleagues that weren't able to join and want to learn about this topic, it will be available on our website. We also have the Cuyahoga Problem Gambling Coalition, which is a group of organizations and individuals working to address the issue of problem gambling here in our county. And so we've had Asia as a partner and member of that organization as it's been active. We'd also have speakers at the Cuyahoga Problem Gambling Symposium to talk on this issue. That is our annual event that we offer. It's a day-long event to offer training and education on the issue of problem and disordered gambling. In March, we have Problem Gambling Awareness Month, which is a time where we do a lot of community outreach to raise awareness, and Asia has been a partner helping us distribute literature, reaching out through their social media platforms. And this year, or I guess early mid-year 2018, we're working on organizing a community forum type event to bring together leaders in the Asian Pacific Islander communities to have a discussion around problem gambling and how do they see effective strategies we could be using to address this issue in their communities. More about the Catalyst Bystander training program. As I mentioned, this was a partnership with Cleveland Rape Crisis Center. They were the experts in the bystander model and worked with Recovery Resources to train us on that model. It was, as I mentioned, it was an effective strategy around sexual violence, specifically with college-age students. So young adults. It was kind of the place in which this was first used. So what we did as a mental health and addiction services agency is bring to that program mental health and addiction as well. So what the students or the participants of the program learn is how would you identify someone struggling? What are the barriers that we have to taking action? And then what are the strategies that we can use to respond to overcome our personal barriers? So after using it with college students, and to this day we continue to use it with college students, really, literally this morning we were out at Cleveland State offering this program. We decided let's adapt this to other populations we work with. So we adapted it to the Asian Pacific Islander community as well as older adults. So when we partner with an agency to adapt a program, there are some different components that happen. The first is a curriculum consultation. Obviously, we need to adapt the presentation for the population of interest. So that can include, mainly the key is updating scenarios. So what type of scenarios are going to be most relevant? What kind of situations is this community going to be within? Then we train our facilitators. So obviously the best facilitators for the program will be those representative of the population we're trying to reach. So for example, we've trained college students, resident advisors, graduate assistants to deliver the program on campus, as well as with Asia, some of the interns and staff that work in the community. And something we're beginning this year is offering ongoing and one-on-one coaching to our facilitators to help them further build their skills and competence in regards to the curriculum. Our outcomes so far with the Catalyst Bystander program with Asia, we have trained 22 facilitators and have reached 122 people through the program. Some of our evaluation results are there, so we're seeing folks a sense of responsibility to intervene, feeling prepared, and plans to use the skills I learned today in the future. And as we get more evaluation data, we're working to figure out strategies and ways we can improve the curriculum to increase some of those outcome measures. Resources related to problem and disorder gambling. Recovery Resources offers treatment, which looks like individual counseling. When we have the census or the number of clients, we have started groups as well. So we offer those counseling services. The way that you access those is we have walk-in assessment from 8 a.m. till 2 p.m. Monday through Friday at our locations in Midtown, Old Brooklyn, and by appointment for folks with Medicaid at our Lakewood office. After going through an assessment, our assessment includes a comprehensive gambling assessment and screen. Those folks can be linked to our treatment program, and all of those services are available at no cost. So there are no need to use insurance or out of pocket, there are no costs. And those services are available for the gambler, but they're also available for family members that have been impacted. We know 7 people tend to be impacted by one person's disordered gambling. And as we know, when dealing with addiction or mental health, the wellness of those supporting that person is also really important. We also have Gamblers Anonymous, which is similar to other 12-step groups. There are meetings throughout the city and county available at their website. There are less meetings than there are, say, with Alcohol Anonymous, but again, those are available. There is also, I don't have it as a bullet point here, but Gam-Anon, which is like Al-Anon, again, a support group for family members that is really important and we often refer people to. Also, we have the problem gambling helpline. So I have the phone number there. That is a first line of access to problem gambling services. So if you live in a county outside of Cuyahoga County, another resource I didn't bullet point here is voluntary exclusion programs, where you can go to the gambling venue and self-exclude from their site. That can be for a year, 5 years, or a lifetime. So that is another resource for folks impacted by problem and disordered gambling. So we are at the end of our presentation. So Kitty's contact information is there. You have contact as the organizer, you have our email as well here at Recovery Resources. So at the end of this presentation, we're going to open it up to questions. We do have one question in the chat, so we'll go to that. And please send in your other questions through the chat feature. So if you want to talk in here, Katie, I'll read it. I'll read it to you. One question is, which is preferred, an interpreter or bilingual advocate?
It depends, I think, on the service. Again, with the role of the bilingual advocate, they're more of trying to help, let's say, they'll be trying to help an individual receive services from other organizations. So taking that person to Job and Family Services, making sure they even accompaniment to court hearing, provide some support as an advocate and help them understand kind of the processes that are going on. But if it deals with something like interpreting between a client and a medical professional, or interpreting for a magistrate or judge, or like even with an attorney and a client, I would say that an interpreter is better for that.
Someone wanted me to restate the question. So the question that we just responded to is, which is preferred, an interpreter or bilingual advocate? And kind of a follow-up to that is someone asked for legal interpreter for treatment. So I think you mentioned that, like, what kind of interpreter or bilingual advocate, what would be appropriate based on the situation? So the next question is the resources for those with a gambling addiction that were free of charge that you mentioned. Are those open to anyone in Cuyahoga County? And the answer to that is yes, they are available to anyone in Cuyahoga County. And the funds that allow for those services free of charge are available in other counties. So if you have clients or people you're working with in other counties that need to access those services, I would suggest you contact the Problem Gambling Helpline, and they'll connect you to the providers in those areas. The question says, where can we find materials of this webinar to review in the future? So I will check and see other questions, and then I'll loop back to that and show you where on the website you can find this information. Are there any special provisions for the Asian gamblers in GA? Are there special 12-step materials written in the person's native language? That is an excellent question, and one at this moment I don't have an answer to. So we will write that down, and I have the person who asked that question, I will send that out. Actually, that's a really good question, so I will make sure to email all of our participants that information. I know in regards to GA meetings, and I guess this would be similar to other groups, can have very different cultures to them. So I think, at least I know off the top of my head, I don't know any culturally specific GA or Gam-Anon communities, but that's an excellent question, and now I'm thinking, is that something I should work on? So excellent question, and thank you. Can interpreters be billed through insurance if needed for a client? Mike.
I need to check on that and get back to you on that one as well, because we, when we use interpreters through different other sources of funding other than like Medicaid, so I have to check on that. I know our clinic has does have funding for interpreters, but I don't know if they're billing through Medicaid. So.
These ones need to follow up. We'll send out an email and make sure on the website we include the questions. Native language. Yeah, so someone clarified native language. So again, I don't know of native language materials. I will send to, if I'm able to find some materials in native languages, and send those out to folks. Is it hard to discuss gambling, or does the client disclose the issue? What I would say is, from my experience, folks are typically pretty willing. Some tips I would have for talking to a client about their gambling is, one, don't ask if they gamble. Instead, just start the conversation of, you know, how often are you, or do you ever go to the casino? Do you ever buy scratch-off tickets or lottery tickets? The point I'm trying to make is people have different impressions of what gambling means. So asking them about what games they use. It's also helpful to not just be inquisitive, you know, how much money do you think you're spending on this? Have you ever become restless or irritable because of your gambling? Have your friends and family ever mentioned something to you about your gambling? And I go into treatment groups here at Recovery Resources and have that conversation with clients, and they're very open to having that conversation. But just like with other substance abuse, there's obviously going to be some resistance or reason in which people aren't going to want to share. How prevalent is sports gambling in young adult community? Wow, lots of questions here that we're going to have to do some follow-up on. I would say sports betting is an emerging issue, and in particular, the state of Ohio might be legalizing sports betting here in our state. So I will try to send a link about that issue so folks kind of reference. I think it was I think Cleveland.com recently had an article on that, so I'll go ahead and send that. Yeah.
A lot of times we don't find a lot of data in the Asian communities in general, but from like anecdotally, I've seen young people, especially the refugee, new American populations involved in sports betting at a very young age, whether or not they know that it's like unhealthy behavior. Because there's a lot of people in the refugee communities, we see they're very much into soccer or what they call football. And I've seen a lot of people, high school teenagers, involved in the sports betting. So.
Mm-hmm. Some folks are having a little difficulty hearing. We just tested it on our end and looks like it's coming through. So I'm sorry about that. But again, this will be available. The video will be available. So if you want to go back and listen to any portion, it will be available. So again, I apologize for that. So Downloadable materials. So again, it sounds like folks are really interested in what materials are available. So we will make sure to make those available and also available on our website where the home study and video of this will be available. I think this will probably be our last question, but someone asked if we could just restate the difference between cultural competency and cultural humility.
So yeah, I can give you the definition of competency. It's basically behavior, a set of behaviors, attitudes, and policies that come together in a system or agency or among professionals and enable that system, agency, or the professional to work in cross-cultural situation. And there's a idea that competency, you reach a level of competency. Like once you reach that, then you're good with dealing or working with the immigrant population. However, cultural humility looks at competence as a more of a process, and so it's kind of defined. It's the ability to maintain an interpersonal stance that is oriented to the other person in relation to aspects of identity that are most important to the other person. So cultural humility knows that you don't reach a level of competence, but you're always learning.
Excellent. Thank you, Kitty. So again, we have reached the end of our presentation. I'm going to go ahead and show you where on our website you can find the recorded videos. So if you see there up at the top, the website is recres.org/home studies. And on this page, if you scroll down, here's all of our home study webinars. So our previous ones are listed there. So this one will be listed under the general category. It takes us, a few weeks to get the video and everything ready. We will be sending an email out shortly with the information. So we'll make sure to, on the page, so for example, if you click on this webinar here, you see the video is there as well as the link to the post-test. So we'll also down here include information about the questions we had, and we really appreciate all those. So just some final things to note here. To receive your CEUs, you will need to complete that post-test and evaluation. You will, again, it takes an hour before GoToWebinar will send that out to you, so your patience is appreciated. To be able to pass, you need a score of 70% to pass the post-test. The link will be sent out 1 hour after I mentioned. Your certificate, so the way the system works is after you take the webinar, your certificate will come up on the screen so you can download it and save it. Again, if you want future information about trainings, I showed you the home study page. Also, if you go here to education, there's information about mental health first aid. If you go under education, under trainings, there's information we have. It's not yet on our website, but a coming clinical. If you are interested in getting your clinical supervision license, it will be featured here. And you can see the gambling training page has information about our upcoming gambling trainings. So one to highlight here is our Foundations in Disordered Gambling. So we just finished that training, and then the stage 2 will be happening in March. Our live webinars and home studies are there as well. Again, thank you for your time. We really appreciate your participation. If you think of other questions you want us to follow up on, you can send them to Ashley Yee, which is the email attached with the webinar, and we'll make those available on our website. Thank you again, and have a good day.